Dr. S.P. Majumdarji, founder, director, and president of Symbiosis. Today's guest of honor, Dr. Arun Jamkarji, Vice Chancellor, Maharashtra University of Health Sciences, Dr. Bhushan Patwardhanji, Dr. Rajiv, Dean, Faculty of Health Sciences, Symbiosis, honorable faculty members, distinguished participants, ladies and gentlemen, and dear students. Well, at the outset, lest I forget, I would like to express my deep appreciation for the hard work over a period of few decades. The way Dr. S.B. Majumdarji has created this institution. He has conceived of this institution brick by brick, erected this institution. I've heard of this institution for a pretty long time, even when I was not health minister. When I was member of parliament for more than 15 years from Maharashtra, in early 80s and early 90s. From those days, I have been hearing about this institution. But I had never got an opportunity to go into deep the man behind this institution. And I'm extremely happy, and I must thank Dr. Vidya, the illustrious daughter of illustrious father, that since morning she told me almost everything about the institution and about his dad. And originally being a science student, and unfortunately I left my this thesis after post-graduation incomplete, I have always the inquisitiveness of completing my thesis wherever I go, whosoever I talk to, and whichever institution it may be, to know as much as I can. And the most impressed I was about the statue of a common man. I myself had an opportunity to unveil maybe hundreds of statues across the country. We find every day prime ministers, presidents, chief ministers, governors, important celebrities unveiling the statues of great men and women, poets, artists, scientists. But I think this is the first time I've heard there's a statue of a common man. This statue does not belong to anybody, but this statue belongs to everybody. Because everybody is a common man. There are very few who are uncommon. So this uncommon statue represents wide mass of India, the people of India. So very thinking of erecting or putting up a statue of a common man in front of your head office of the society will give fair idea what a person would be thinking and person would be like. So I must congratulate you from the core of my heart, because unfortunately, very few people are left in our country who think of common men. Now money has become God, most unfortunately. Be the politicians, be the businessmen, be the professionals, for that matter the doctors, a noble profession, which still it is. And I think after any sick person of the God, any sick person would like to worship the doctor. But over a period of time, the society has changed, the mentality has changed. Everybody is after money. So money has become the God, and God's own personality has been utilized. So there's still a person running a huge institution. The boys and girls come across the country, boys and girls coming from across the planet, and yet the money is no criteria. The student may have or may not have the money, but to provide a good, affordable education, that is the motive which you have in front of you, and you are imparting that type of education to thousands and thousands of students everywhere. Now, ladies and gentlemen, it is indeed a pleasure to be amongst you for this valedictory ceremony of the 13th National Seminar on Hospital and Healthcare Management and Medico-Legal System, organized by the Symbiosis Institute of Health Sciences. I compliment the Institute for conceiving this novel idea and for consistently and successfully hosting 12 such seminars in the past. This event serves an annual reiteration of the commitment of Symbiosis International University and its constituent institutions towards disseminating high-quality education. This seminar is also a unique platform for the coming together of various stakeholders in healthcare delivery, be they medical doctors, lawyers, corporate, and even lay persons like me. Ideas and experiences get shared, knowledge is disseminated, and the participants exit as better informed stakeholders of the health sector. It is indeed heartening to note that similar interdisciplinary efforts are being made by many other organizations as well, such the India Health Summit 2010 organized by CII, followed by the ESCON at AIIMS, New Delhi. What has gladdened my heart is the upfront acknowledgement in all these conclaves that the new healthcare system in our country would need a marked shift from patient centricity to human centricity, and also finer balance between profitability and corporate responsibility. I therefore take this opportunity to commend you for institutionalizing this interdisciplinary effort, but also to exhort you all to use this forum to strategize improvements in our healthcare system. The healthcare sector is a now happening sector in our country. It is witnessing unprecedented growth over a period of time. Thanks to the impetus provided by the National Rural Health Mission, the Government of India over the last 5 years has invested nearly 45,000 crores to improve the healthcare infrastructure right from the sub-center, sub-district up to the district hospitals. We are now aspiring to taking the total allocation for the health sector to 2 to 3% of our GDP in the 12th five-year plan period. That starts from 2012 April. By next year, 6 state-of-art tertiary care institutions modeled on the lines of All India Institute of Medical Sciences will be ready in the underdeveloped and underserved regions of the country at an estimated cost of 5,100. This is one in UP, one Bihar, one Madhya Pradesh, one Chhattisgarh, one Rajasthan, one Uttarakhand, and one Odisha. So these are the most backward and underserved areas of our country. The medical colleges will be ready by September, and nursing college also will be ready by, I think, September, October. The hospital, 100,000 bedded hospital will be ready by next June. So both these medical colleges, nursing colleges, and the hospitals, 6, they will be through by next September and operational by the end of next year. So these hospitals will take a lot of load from these underserved and backward areas. Likewise, over 1,350 crores are being invested in government medical colleges for expanding medical seats, and 2,000 crores rupees on establishing 250 nursing schools in the country in the same underserved areas, so as to increase the overall availability of the health personnel in these states. So far, more than 15,000 medical doctors and specialists from the Indian medicine and 70,000 ANMs, that is auxiliary nurse midwife, and nurses, and more than 800,000 ASHAs, that is accredited social health actives, have been added to the Indian public health system during the past 5 to 6 years since the launch of National Rural Health Mission. Ladies and gentlemen, we have realized that in spite of having more than 730,000 doctors and 930,000 nursing personnel on the rolls, a significant number of healthcare professionals are concentrated in the urban and semi-urban areas, leaving a huge gap of availability of health manpower at the grassroots level. The Ministry of Health and Family Welfare has taken several path-breaking initiatives during the past 2 years, not only towards mitigating the requirements of the rural health manpower, but also towards capacity building for the health professionals in the country. With a particular focus on increasing the availability of medical human resource in India, we have relaxed the requirement of the land for opening more medical colleges across the country. As against 25 acres of one piece of land, now it has been rationalized to have only 20 acres of land. And in the backward areas, like northeastern states and some hilly states of the country, it's very difficult to find one piece of 20 acre also. So we have said it can be in 2 pieces, 10 acre each, at a within a distance of 10 kilometers. And then it's very difficult, cities like Mumbai, Pune. So we have identified as many as 12 cities across the country, the major cities, where it's very difficult to find even 20 acres, even in 2 pieces. So we have relaxed the land requirement further. So in such cities, Pune, Nagpur, Bombay, Bangalore, Hyderabad, Chennai, Delhi, you need only 10 acres of land, total 10 acres of land. And instead of going horizontal, one can go for vertical. Due to geographical diversity in India, there are areas where special provisions have been made for hilly and other geographical disadvantaged areas, as I have already mentioned this. So we will also be adding the capacity of 22,000 nurses annually, including A&Ms and GNMs. Last year, we have sanctioned 150 such colleges, and within next month, we'll be sanctioning another 100 such A&M and GNM schools. Operationally, these wide-ranging initiatives would definitely bridge the identified crucial gaps in the domain of the requirements of the trained health manpower as against the prescribed ratio for health care delivery system. The challenge is now to ensure that the desired quality of teaching and training is not compromised with any manner. Another important initiative taken is to allow corporates to set up medical colleges in India. So far, the corporates were not allowed to set up medical colleges. Henceforth, they are and they will be allowed to set up medical colleges. On the sidelines of these steps, we are willing to promote public-private partnership in certain areas of the country where there is an urgent need to have more medical institutions. Apart from this, to increase the number of specialists in the country, we have also relaxed norms describing the teacher-student ratio in medical colleges and other institutions in India. You will be surprised that the number of when I realized there was an ongoing war going between the MCI and the private medical colleges, for that matter, even the government medical colleges. Then I realized, I went deep into it, what is the reason? Well, the most of the medical colleges were rejected by medical council or not given permission to continue in their courses in spite of permission being given for the first year. The reason was that there was acute shortage of faculty members. It's very easy to create infrastructure, but it's very difficult to create a human resource over a night, particularly a doctor and a postgraduate doctor. So we realized, we studied the education pattern of most of the developed countries, and we realized that in most of the countries, the student-teacher ratio, student as a postgraduate student and teacher as associate professor or additional professor or for that matter professor, in our country it was only 1:1 ratio. So in most of the developed countries it was 1:2 ratio. So we increased this ratio last year. We gave direction to medical council that they should increase this ratio. Last year it was increased, this time also it was increased, and you will be surprised to know that in just 2 years period, the number of postgraduates intake has gone from 13,000 to more than 20,000. 7,000 increase has taken place in just 2 years' time. And I'm sure that in next 2 years' time, we would like, our goal is to make it double within 4 years' time. And within next 2 years' time, I'm sure that it will be 25 to 26,000, intake of postgraduate students. So that will help us in both ways, in creating more specialists, and also at the lecturer level, you will have large number of postgraduates available for the faculty. And those who are lecturers, they will be kicked up. So the purpose is to have more medical colleges, and for more medical colleges, to create more human resource, we need to create more intake in postgraduate. Then only we will be able to offset the problem of shortage of doctors. In addition to that, the postgraduate degrees obtained from 5 English-speaking countries have also been recognized in India. These countries are United States of America, Canada, and UK, Australia, and New Zealand. So far, till last year, the postgraduate degrees from these countries, for that matter from any country, were not recognized. But these are the English-speaking countries, and the standard of these countries is also very good, so we have recognized. Now I would appreciate if you have some your relatives, friends in different parts, in these parts of the country, please use your good offices and try to attract the attention of those doctors who have done their post-graduation, and they should come back. It's not only they can come for teaching, not only for practice. Of course, they will be allowed for both practice and teaching. Now we are going to recruit, today was the interview for the doctors of these 6 institutions, and within next 2-3 months we are going to go for the interviews for the faculty. So they can become the faculty members for 6 All India Medical Institute-like institutions. Ladies and gentlemen, in our country, health is perceived to be in the domain of the state governments, be central or state. Therefore, any effort to improving equity in access to health care is expected to the state or public funded. The poorer perceive the state to be the central to individual and collective life, and hence see a greater role for the state in providing health care. While the middle and upper sections of the society also see the government's role in putting insurance mechanism and regulatory mechanism in place so that they could access quality care in private sector, while both views reiterate the importance of state involvement. During the past decade or so, various reforms have been made in the health sector. Attempts have been made to assimilate the services of the private sector into public health care delivery through various strategies like competitive contracting, subsidizing private providers, and outsourcing. I believe these have been primarily directed towards privatization of services because of the inability of the public sector to meet expectations of our people. This has naturally been followed up with criticism that the private sector was being nurtured at the cost of the public sector. The private sector has also come in for criticism because of high cost of treatment and its reluctance to reach rural areas because of high risk involved, so by perception may not be to that extent otherwise, and therefore only catering a selective section of the population. As per available estimates, 58% of hospitals, 29% of all beds, and 81% of all doctors, and 77% of outpatient cases in rural areas, and 80% in urban areas are in the private sector. The private sector also brings in much needed bed capacity, skilled human resources, and some degree of efficiency. The short point to be made is that both the public sector and the private sector need to coordinate their investments and growth in the health sector in general, in larger public interest. We are a country with 1.2 billion population. Therefore, the gap between demand and supply of all healthcare resources would always remain. It might only become wider with improvements in life expectancy and emergence of lifestyle-related diseases. When resources are not sufficient, we must learn to become more efficient. We have to manage these precious health-related resources as much as possible for the good of our people. But the question is, are we doing it? Years of prolonged underfunding of public health system and dependence on the private sector has pushed the cost of the health care and has also affected access. The NSS 060th around 2004-2005 has clearly brought out the fact that there is more than rupees 3,000 expenditure in government hospitals in rural areas during every hospitalization which is met out of pocket. The out-of-pocket expenditure in the urban areas and the private hospital is 4 to 5 times higher. Is this happening due to the absence of any accountability in the health sector? This is a big question mark. I personally believe that each and every one of us has to be accountable to the people of India to deliver quality health care at an affordable price. These concerns would get addressed on their own if all health care delivery was based on humane approach. This has been significantly absent in public sector institutions, this lack being attributed to grossly overburdened health services. Unfortunately, in many private healthcare institutions, commercial pressure has blurred the distinction between hospital and hospitality. It is imperative that we as a country collectively overcome these drawbacks to give quality health care to every Indian. While technology is increasing in its sophistication, the human touch seems to be getting lesser and lesser. Ladies and gentlemen, I am not a health expert, but I have reasonably a good idea about the healthcare needs of our people, especially the weaker and deprived sections of our society. And I speak from my heart. The thoughts I have shared with you are genuine concerns. Therefore, I hope that during discussions in this seminar which you have had, you felt challenged enough to work out a blueprint for the healthcare system that is based on principles of quality, affordability, and equity. Such an inspiration would eventually obliterate the distinction between the public and private sector in healthcare delivery. The approach of both sectors would be tempered by the underlying thought that every patient is a human being, just like you and me, and should be and would be treated as we would like to be treated ourselves. I'm confident that these would be the guiding principles for all future national seminars to be organized by the Symbiosis Institute of Health Sciences. At the end, I must congratulate Symbiosis Institute of Health Sciences for setting an example by organizing this national seminar on health and health care management and medico-legal systems for the 13th time in a row. Your commitment and vision is indeed commendable. I hope that you will witness many such other positive initiatives from this group. Before I conclude, I would like to assure the Honorable Founder and the President of the Symbiosis and the scientists working here that you have already forged symbiosis with number of states and countries. So I would like to have a reciprocal symbiosis between the Health Ministry and the Symbiosis. And that will do lot good for the entire country. We have the funds, we have the resources, but in our country we have the scientists, and we have private institutions with capacity, capability, knowledge, human resource. I think we need to work hand in hand. And this money which is available with the government, which is available in my ministry, it's available with other ministries for the research. So we would not like to only use the medicines or the inventions which have been made by somebody else. While having chat over lunch, I told you that our health research department in my ministry, after every third or fourth year, one department is added. About 20 years back, this ministry was very small ministry, maybe with secretary and one joint secretary. Now we have 4 departments, 4 secretaries, almost 45 joint secretary level officers, and maybe few hundred directors and so many and so forth. So the scope has widened, and the health research department has been added only 4 years back, rather 3 years back. Now, the idea is, it's a huge country. We cannot depend on the scientists of other countries to develop something and then just depend on them what they are doing to develop. So in a country like our huge country, we have to fall back on our own scientists. They must develop. We must develop our own things. We must develop our own medicines. So I am proud that today, insofar as the medicine is concerned, we are almost number 2 or number 3 in terms of volume insofar as production of the medicine is concerned. And this is growing every time. But the research part, we are missing. So I would like to engage as many as in universities and scientists from within the country to continue their research in different areas so that the ministry is fully backed by the scientists and the research scholars and whatever research or whatever things they do, and we carry forward and implement that. With these words, I thank you and wish you all the best. Thank you very much.